Hello everyone, today's topic is submandibular gland. Submandibular region. First of all, submandibular region. It extends from submandibular fossa of body of the mandible. In the body of the mandible, this is mandible on medial aspect. This is mylohyoid line and this is submandibular fossa. Submandibular fossa. So submandibular region is extended from submandibular fossa of the body of the mandible to the hyoid bone. This is the extent of submandibular region. It contains submandibular gland, sublingual gland, two major salivary glands, submandibular and sublingual glands, then suprahyoid muscles extended up to hyoid, then muscle above the hyoid bone are suprahyoid muscles. Suprahyoid muscles are also content of submandibular region. Extrinsic muscles of tongue includes hyoglossus, genioglossus, styloglossus. Two nerve, lingual nerve and cranial nerve 12, that is hypoglossal nerve. One ganglion, that is submandibular ganglion. These are the contents of submandibular region. Submandibular gland. First of all, definition of salivary glands. What are salivary glands? Salivary glands are group of compound exocrine glands. The function is to secrete saliva according to Auburn's. Now, parotid gland, sublingual gland, submandibular gland. Three major salivary glands and minor salivary glands, labial and buccal gland, glossopharyngeal and palatine glands, lingual glands, von Ebener's gland. So, salivary glands are classified basically on anatomically. We classify glands in major and minor salivary glands. Major, three paired salivary glands: parotid, sublingual, submandibular. Now, minor salivary glands are labial, buccal glands, glossopalatine glands, palatine glands, lingual glands, then von Ebener's gland. Salivary glands, based on their secretion, also classified into serous, mucous and mixed type. Now, embryologically, origin from where the gland development. Submandibular gland originated location is floor of mouth, approximately 6 to 8 weeks of intrauterine life. And salivary glands start secretion. Their secretory piece get mature during the last 2 months of gestation, that is approximately 7.5 to 8 months. This is picture. These are the developing submandibular glands. This is tongue. This is Meckel's cartilage. Now, submandibular gland, gross anatomy. Submandibular gland, shape walnut, weight 10 to 20 grams. What type of gland? It is mixed gland. But secretions are mainly serous. Location, it is located in digastric triangle. Lodges partly in submandibular fossa of the mandible. This is J-shaped gland. This J-shaped gland is submandibular gland. J shape is because mylohyoid muscle divides the gland into two parts, superficial and deep. This is sublingual and this J-shaped gland is submandibular gland. Now, submandibular gland, total saliva, it secretes about 65 to 75% of total saliva. Located at posterior portion of the floor of the mouth, medial aspect of the mandible, wrapping around the posterior border of the mylohyoid muscle. This is mylohyoid muscle. This is mylohyoid muscle. Floor of mouth, mylohyoid muscle form floor of mouth, and posteriorly, anteriorly mylohyoid is related with sublingual gland, and posteriorly it is related with the submandibular gland. It divides submandibular glands into two parts, superficial and deep part. Now, three surfaces of superficial part. Posterior border of mylohyoid divides gland into superficial lobe situated in the digastric triangle wedged between the body of the mandible and the mylohyoid, and a small deep lobe. J shape है, इस तरीके से J shape, और यहाँ बीच में mylohyoid muscle है. This is superficial part situated in the digastric triangle wedged between the body of the mandible and the mylohyoid muscle, and this small deep lobe is lying in the floor of mouth between the mylohyoid and hyoglossus muscle of lateral aspect of tongue. This is submandibular fossa, location of the gland mylohyoid line. This is sublingual fossa. Mylohyoid line divides two glands, sublingual and submandibular gland. Each gland two parts, superficial and deep. Same in this diagram. This muscle is mylohyoid muscle, and mylohyoid muscle के posterior aspect पे wrap हो रहा है इसका superficial part J, and इसके नीचे की तरफ जो चला जाएगा that is the deep part, J shaped gland. Similarly, this is mylohyoid muscle from floor of mouth. Then anteriorly we have sublingual. This is sublingual gland anteriorly, and posteriorly, on posterior aspect of mylohyoid, above the mylohyoid, superficial part of the submandibular gland, and below the mylohyoid we have deep part. Deep part is small, superficial is larger portion. Superficial part of submandibular gland is further divided into two ends, anterior end and posterior end, and three surfaces, inferior, lateral and medial surfaces. In this diagram, this is J-shaped gland, mylohyoid muscle, anterior end and posterior end, anterior and posterior end of superficial part. Now, anterior end extend up to the anterior belly of digastric. This is anterior belly of digastric. This is anterior belly of digastric, and this is posterior belly. Anterior end of superficial part extend up to the anterior belly of digastric, and posterior end extend up to the stylomandibular ligament. This is the posterior belly, and here is stylomandibular ligament, which separates the submandibular from the parotid gland. Question आता है इसके ऊपर, which ligament separates submandibular and parotid gland? That is stylomandibular ligament. This posterior end presents a groove for the lodgement of ascending limb of cervical loop of facial artery. This is the loop or groove for the lodgement of ascending limb of facial artery. Now, this is facial artery and this is lingual artery. Both facial and lingual artery are branches of external carotid artery. तो posterior end have कैसे आइडेंटिफाई करेंगे, उसके ऊपर एक ग्रूव है फॉर फेशियल आर्टरी. एंटीरियर एंड एक्सटेंडेड अप टू द anterior belly of digastric and posterior up to the stylomandibular ligament. Apex of parotid gland also lies in digastric triangle. Both both glands, submandibular and apex of parotid gland, lies in digastric triangle, and both glands are separated by stylomandibular ligament. And in floor of mouth, sublingual and submandibular glands are separated by mylohyoid muscle. This is posterior end. This is the anterior end. Coronal section में अगर हम देखें, anterior end and posterior end. This is mylohyoid muscle. This is superficial part and this is deep part. And posterior end पे यहाँ पे क्या है रिलेशन में facial artery. Now, among the three surfaces, investing layer of deep cervical fascia. अब surface देखेंगे तो we have two ends, anterior end and posterior end. Anterior end extended up to the anterior belly of digastric and posterior end is extended up to the stylomandibular ligament. Now we have three surfaces: inferior, lateral and medial surface. Among the three surfaces, investing layer of deep cervical fascia splits into two layers to cover the inferior and medial surface of the gland. This is coronal section of superficial part. Coronal section. In coronal section, if we see, this is mylohyoid muscle, mandible. This is submandibular gland. This is gland. Investing layer of deep cervical fascia. Dissection देख रहे हैं, coronal section, then skin, then platysma, then investing layer of deep cervical fascia. This deep cervical fascia splits into two parts and cover the medial surface of the gland and inferior surface of the gland. Laterally क्यों नहीं जाएगा? Because laterally we have mandible. Medial surface किस तरफ आएगी? जिधर माइलोइड मसल है, एंड इंफीरियर सरफेस बाहर की तरफ, एक्सटर्नली. इन्वेस्टिंग लेयर कवर्स टू सरफेसेस, inferior and medial surface. Laterally नहीं जाएगी because laterally we have medial surface of mandible. Now, relations of surfaces. Inferior surface present relation. Inferior surface relations. It is covered by skin, superficial fascia, then platysma and deep cervical fascia, crossed by common facial vein. This is the facial vein, common facial vein, and a branch of facial nerve, cervical branch of facial nerve under platysma, and some mandibular lymph nodes. This is the relation of inferior surface. Laterally we have submandibular fossa because lateral surface is related to the medial surface of the mandible. We have submandibular fossa of the mandible, and in relation we have medial pterygoid muscle, close to its insertion of medial pterygoid muscle. On medial surface, medial pterygoid muscle get inserted. facial artery which form loop that is downward and forward between the bone and the gland. And then facial artery winds around the lower body of the mandible, then artery goes on face to supply the face. Medial surface is extensive and it is divided into three parts: anterior, intermediate and posterior parts. Now medial surface, anterior part it rests on mylohyoid muscle. This is mylohyoid muscle. Anterior part rests on the mylohyoid muscle. And intermediate part, this is intermediate part rests on this straight muscle, that is hypoglossus muscle, and it is related to lingual nerve and sublingual ganglion. And posterior part is related to, this is posterior belly of digastric, styloglossus muscle, this is styloglossus muscle, lingual artery. These are the relation of the posterior part of superficial, medial surface of superficial part. Now hypoglossal nerve and first part of lingual artery are also related. With lingual artery we have, this is hypoglossal nerve. This is also related to the posterior aspect of medial surface. Now deep part extend forward in between the mylohyoid and hyoglossus muscle. In between the mylohyoid and hyoglossus up to the posterior end of the sublingual salivary gland. Relations: laterally we have mylohyoid, medially we have hypoglossus, above lingual nerve and submandibular ganglion, below hypoglossal nerve, accompanied by a pair of veins, and these veins are termed as vena committant. जैसे हम हाथ में पढ़ते हैं वेना कमिटेंस, सेम वेना कमिटेंट hypoglossal. Now submandibular duct is also termed as Wharton's duct. It is 5 cm long. It begins in the middle of the superficial part of the gland, little behind the posterior border of the mylohyoid muscle, and duct passes at first upward and backward for about 4 to 5 mm and then run forward and upward through a deep part of gland, mylohyoid and hyoglossus, and then in between the sublingual and genioglossus, and finally opens into the floor of the mouth, that is sublingual papilla on each side of the frenum linguae. Let's see in diagram. This is duct start is approximately here. Little behind the posterior border of the mylohyoid. This is mylohyoid muscle. यहाँ से approximately start होगी duct, and this is the duct. Runs start behind the mylohyoid muscle, start the duct, then in deep part, then it run forwards in between the mylohyoid, and this is mylohyoid muscle and this is hyoglossus muscle, in between the mylohyoid and hyoglossus, and it opens in floor of mouth on each side of sublingual papilla, on each side of frenulum linguae. Opens in floor of mouth at sublingual papilla. Now duct presents an intimate relation with the lingual nerve. At first, the nerve lies above the duct and crosses its lateral side and finally ascends medially, winding round the lower border of the duct. This is the nerve, this is nerve, and this nerve form U-shaped loop around the Wharton's duct. Now, this is important. Blood supply, it's supplied by submandibular gland is supplied by facial artery and lingual artery. Both are the branches of external carotid artery, and venous blood is drained into jugular vein. Lymphatic drainage into the submandibular lymph nodes, and then finally drain into jugulo-digastric lymph nodes. Now, nerve supply is important. Both parasympathetic and sympathetic nerves supply submandibular gland. Both parasympathetic and sympathetic are secretomotor for gland. Both are secretomotor for gland. Sympathetic nerve comes via winding around the facial artery. The postganglionic fibers wind around the facial artery, and these postganglionic fibers come through superior cervical ganglion, and sympathetic stimulation produce sticky mucus rich saliva, and it is sympathetic also act as a vasomotor supply. Now, parasympathetic preganglionic fibers arises in superior salivatory nucleus of the pons, then come into the facial nerve, then facial nerve to cauda tympani to lingual nerve. Fibers relay in submandibular ganglion. Submandibular ganglion is also termed as Langley's ganglion, and then postganglionic fibers. Important point: postganglionic fibers directly from ganglion to gland, passes directly from ganglion to gland without passing through lingual nerve. When postganglionic fibers pass into lingual nerve, they supply sublingual salivary gland.